Hello, everyone. My name is Dr. Vivian Asamoah. I'm an integrative gastroenterologist in Houston, Texas. And thank you for joining us on another episode of Back to Basics. We present every Thursday at 6:30 p.m. Central Time about a very important topic, always something related to the gut and how the gut connects to the rest of the body. And as we're learning more about the microbiome, it's becoming very evident that we have to pay attention to our gut health. So, welcome to another episode. And today we're going to be talking about your gut and your skin and how the two are connected. And it's been a wonderful opportunity for me to really dive into our patients we see in gastroenterology practice who present with skin issues and how the connection really is. But let me start by asking, how often are you buying skincare products? Like I know I am. I'm like, I see something new and I'm like, oh, this is going to be great for moisturization. This is going to be great for my skin. There are some critical things that I use, in terms of sunscreen and using the right SPF, and making sure that my skin is always moist and well hydrated, because we all have different skin types, and we'll dive into that. But I never really thought about how the gut microbiome and my gut health impacts my skin until I started having some skin issues in the past, right? We all have skin issues, most of us, during those hormonal changes. So, right at that puberty stage, and then even perimenopause and postmenopause. But in between, we can actually see how different foods can impact the gut. And that's what I want to talk about, impact the skin. And I really want to dive into that. So the skin is a very, very important organ. We take care of it because it is a natural barrier protector. And it's one of the largest organs in the body, and covers a huge surface to protect us and kind of shield us from everything that we're exposed to. So the skin covers an area of about 2 square meters and accounts for about 15% of our body weight, which actually makes it one of the largest organs in the skin, right? And so very, very important that we protect this skin. And it has three layers, important to know. It has the epidermis layer. It has the dermis. So the epidermis is just the outer layer, waterproof. It's got the dermis, where we have the hair follicles and the sweat glands and nerves and blood vessels. And then it's got the hypodermis, or a subcutaneous deeper tissue that connects to like muscle and bone and things like that. So it's got those different layers that help protect us. And it biggest thing, it's our protectant, right? It really gives us that barrier, almost like that external shield. It helps regulate our temperature, cool our body, and most importantly, when we sweat, it helps secrete toxins that need to be eliminated from the system, right? It also retains nutrients to be absorbed by other organs. So it has very important role in general. We don't talk about the skin flora a lot, but as I mentioned previously, we know it can be affected by many things, but let's start with what that means. The skin flora, just like we talk about the microbiome and the gut flora, well, there are about 1,000 different species of bacteria identified on the skin so far. Data has shown us there are 1,000 different kinds. So along with having that barrier, it also has microorganisms of bacteria that work along with it, just like the microbes in our gut that work along with it to do its function, right? So when the skin biome, let's say the skin flora is off, it can certainly affect our skin. When the microbiome of the gut is also off, it can also reflect on that bacterial layer on the skin surface too, right? Many skin types, dry skin, we've got some people with oily skin and then some people with combination. I think I have combination, and it often depends on what I'm eating, right? So in people with dry skin, they lack that sebum, right? That sebum that actually helps retain moisture. And then with people with oily skin, they very often have an excessive amount. And that sebum and the amount of production from the sebaceous glands can be affected by hormonal imbalance. Some of it can, of course, be genetic. My family, long family history, we all have oily skin. And some of it can be related by stress, right? So just to know the different types. So Spoke a little bit about the gut microbiome, spoke a little bit about the skin flora, microflora, and the two are obviously connect. So where we hold most of our microbiome is in the gut, right? But there's definitely a connection between what we have on our gut and what we also have exposed on our skin. And the gut is responsible for absorbing nutrients, housing helpful and harmful bacteria sometimes, and excreting waste. So very similar to what happens on the skin flora, right? But it's important that we have the right set of nutrients, right, and the right set of microbes, so that we can actually do the job. The gut can actually do the job that it needs to do, right? So there's this tandem, there's this play between our gut microbiome and food and the foods that we eat and how we extract nutrients from the food, how we digest the macronutrients from the food, and how we use the nutrients overall to help maintain our motility, the immune system of our gut, our hormonal balance, and our excretion, like detoxification processes, right? And so we have to make sure that we are eating right to have the right microbes that we need, right? The healthy organisms, the healthy bacteria to make sure everything's going on and everything's able, the gut is able to do its work. Same applies to the skin, right? So whatever consuming can also affect that skin microflora and affect the function of the skin. So that is that gut skin axis, that gut skin connection that's really important. So the health of the skin is dependent on what's happening in your gut. And there's so many studies that show that sometimes treating gut issues helps skin issues, right? So that gut as a barrier and that skin as a barrier to toxin, extremely important. There are many conditions that we see in gastroenterology where there's a combination. We see that interplay between what's going on in the gut, and if there's an imbalance in the gut, that subsequently leading to skin issues. One of the biggest ones I would say is hyperpermeability, or what we'll say in layman's terms as leaky gut, which a lot of gastroenterologists and scientists don't want to use that term because I think it's being misused or misunderstood. But it's something that our patients, the general population, really connect with and really understand in simplified terms. But we will call it intestinal hyperpermeability, where the membrane, sort of the connections in the intestines are a little bit disrupted, and we see a passage of antigens, um, uh, what we call endotoxin products from bacteria seeping through, and even large antigen molecules from food crossing over that barrier into the bloodstream and then causing other symptoms, right? And one of the major symptoms or signs it can cause is skin issues, right? So we'll see in someone who's got that hyperpermeability issue from different reasons, right? It just means there's leaky gut. You can have leaky gut if you're not eating right, you're eating a lot of processed foods, you're stressed, hormonal imbalance, you're drinking a lot of alcohol, taking medications like Motrin, Aleve, and Advil. Those are NSAIDs. All of that can contribute to leaky gut. So it's a kind of like it's a balance, it's a homeostasis, it's like a flow in the microbiome and as well as the intestinal integrity. And that flow can sometimes be off where things are really leaking through. There's hyperpermeability, or it's steady. And keeping things steady is where you want to be, right? But sometimes when there is that hyperpermeability and leaky gut, we'll sometimes see symptoms like eczema get worse, psoriasis get worse, acne, rosacea. All of those skin issues have been connected with an imbalance in the gut microbiome. So when that lining becomes compromised, and we said undigested foods kind of pass through bacterial products and endotoxins, pass through into the bloodstream, triggers inflammation of the skin and the skin issues. I sometimes will also see this in my patients with SIBO, so bacterial overgrowth, right? Which ultimately in itself leads to leaky gut. So we can see a lot of skin issues or skin complaints like a rash. I just have this rash here. I have this, my eczema is really flaring up in our patients with SIBO. And treating the underlying SIBO generally helps treat that. The skin issues too. In inflammatory bowel disease, so our patients with Crohn's disease and ulcerative colitis, we actually see very specific inflammatory skin conditions like erythema nodosum, which are little red bumps that are often painful on the shins. of the legs, pyoderma gangrenosum, we'll see psoriasis in our patients with IBD. And it's part of that systemic inflammation process that truly we believe is happening from the chronic inflammation of the gut and causing the skin manifestations as well. Food sensitivities. There you go. Food sensitivities and intolerance known to affect the gut. I mean, you can see the immediate, if someone actually has a food allergy and they eat something, one of the first areas that's going to be affected is the skin. Very often there's an urticaria, there's a rash, because there's that antigen that got exposed into the bloodstream, and now you've got this vasomotor activity affecting the skin, right? We'll see people develop a skin rash or itchy skin. When they have food allergies, it's immediate. When they have food sensitivities or intolerance, it's very often delayed, but we'll definitely see people say, just even with gluten, right? Think about gluten in our patients with celiac disease who'll say, I had gluten and I immediately got a rash or I started itching. And there's actually a chronic skin condition that our patients with celiac disease suffer from called dermatitis herpetiformis, which is there are these kind of lesions, vesicle lesions on the skin when you eat gluten. And when you stop eating gluten, it goes away. Immediate connection, right, between that skin and the gut. We'll see it in fungal overgrowth. So our patients who also have what we call SIFO, small intestinal fungal overgrowth, or just candida overgrowth in general. And we'll see that predispose them to other fungal skin infections of the skin, vaginal infections, eczema, psoriasis. And when we treat the fungal overgrowth, that sometimes get better, not always, because again, it's usually multifactorial, but a big portion of it could be related to what's going on in the skin. And then generally, if your nutrition is bad, if you're eating a ton of processed foods, if you don't have the right vitamins in place, right, you're not eating enough, you're not eating enough vitamin or nutrient-rich foods, you're depleted in vitamin D, depleted in vitamin A, depleted in zinc, and depleted in some essential essential fatty acids. We can all see this impacting the quality of your skin, your hair, your nails, right? So there's definitely absolutely a definite condition. With acne is the most common skin condition we see affecting about 85% of people at some point in their life. And in the past, I think we all used to believe that greasy foods like French fries and fried food caused acne, but we actually know that it's really, I think, more so about the processed foods. The oils affect the gut microbiome and then in turn affect the skin. It's actually interestingly, I read about one or two studies, small population studies, where patients diagnosed with SIBO, when their SIBO was treated, the acne got better. And think about it, guys. What's the common treatment, long-term treatment for acne? It's an antibiotic, right? It's either doxycycline or something like that that is going to alter that gut microbiome, treat that imbalance, and then, help the skin. The problem is long-term use of antibiotic has its drawbacks, has its negatives. We don't want to do that long-term. And so working as holistically as you can through nutrition and lifestyle, making those changes by avoiding those foods is probably the best way to go. I often will recommend digestive enzymes in my patients with skin disorders because skin issues that I think are related to the gut, because those enzymes are really important for breaking down protein. Right. And if you don't have enough, as would happen when you have a underlying gut issue, protein and amino acids, super important for a healthy skin. Right. And if you're not breaking down the protein to release the amino acids that you need on your skin to build your collagen blocks, to build your amino acid blocks, it can be an issue. And so I often will recommend that they consuming enough healthy fats, enough healthy proteins, and I'll add on a digestive enzyme, which is really supportive to help digest better, especially my patients with psoriasis. I've noticed that makes a huge difference. Let food be thy medicine and medicine be thy food. Start always with nutrition. So, you've got skin issues. First place to look at is, of course, you want to consult a dermatologist. I'm in no way a dermatologist expert, but I have noticed that in my patients with gut issues, when their diet is improved, definitely helps the skin issues. It may minimize the need using medications. It may minimize the need for the recurrent flares or the frequency of flares. It may minimize the need for a biologic or how often you're having to change biologics. So working on the gut is extremely helpful. And there are some foods that we know are going to be very helpful to heal both gut and skin. So bone brothing has collagen in it. You can also add added collagen, known to be helpful for gut and skin. Fermented vegetables such as sauerkraut, kimchi, great ways to boost your metabolism. They are prebiotic rich foods, so help with the beneficial bacteria in your gut. I love using digestive enzymes, as I mentioned, but I also like using some natural bitters, like Swedish bitters. Well, it's an herbal tonic that will just kind of stimulate digestive enzyme production, and all the juices, gastric juices, biliary juices, pancreatic juices to help with digestion and reduce chronic inflammation. I like drinking kefir on a regular basis because it's rich in probiotic lactobacilli, and that is very, very useful for the gut and skin complexion. Coconut oil has natural antimicrobial benefits as well. Great and rich in fats, helpful for healing that gut skin axis, right? So think about foods, think about things that you're consuming that could help heal the gut, enrichen the skin microbiome as well. Eating foods rich in polyphenols. We say this all the time to all our patients, no matter what. So, polyphenols are like cacao, grape skin, green tea, almonds, onions, blueberries, just basically that rainbow color plate, rich in polyphenols, right? Grains, fiber that contain fiber, the healthy fiber that's going to fuel your colon cells to make short chain fatty acids, which are basically the fuel of the gut, right? The large and small intestine, really important. So you want whole grains, rye, barley, brown rice, quinoa. That's the diversity that you want to be looking for. Foods that are rich in prebiotics. I can't emphasize this enough. Everyone is like, should I take a probiotic? I'm like, start with a prebiotic, natural food that's going to enrich in that microbiome and get the beneficial bacteria to really grow and sustain. Legumes, oats, bananas, berries, asparagus, dandelion, leeks, garlic, all rich in prebiotics, right? These are things you want to incorporate into your diet on a regular basis. Of course, unless there's a sensitivity that you're aware of and you want to kind of be careful on that, but there are always swaps, right? You can always swap one thing for another. But rich foods and prebiotics, super helpful. We talked about the fermented foods and the things you want to avoid. There's a picture of white rice here. That's the least of my problem in the United States. I think it's the least of our problems, right? We are really worried about things that we know will impact the gut, the skin directly, will impact the gut skin axis. Let's say high sugar, high fat, right? High fat diets definitely shown to have an impact, a negative impact on gut bacteria, skin, and gut, right? Additionally, artificial sweeteners negatively impact the gut microbiome, thus will affect the skin. Avoid the refined white grains, and that's why I have a picture of white rice here. Too much of it can be pro-inflammatory and negatively impact, right? And then other pro-inflammatory foods that we know in general. So if you are going through a flare of whether it's acne, psoriasis, eczema, cut back on gluten, cut back on dairy, cut back on corn, soy, caffeine, alcohol. All of these are known to be pro-inflammatory triggers, right? So those are just some general tips. When it comes to supplements, there's some data out there, but not all skin disorders are the same. The causes are different. So I want us to be very careful today. We're really just talking about that skin gut connection and the impact of that gut microbiome, and that what we're consuming can certainly impact our skin. But there's an interplay of genetics here, right? There's an interplay of hormones. So all of that has to be looked at and weigh the pros and cons. But at least with this conversation, I hope it empowers you guys listening to understand that there truly is a connection and that you do have some control over the triggers that may flare up skin issues. I know for me, it's peanut, it's sugar, it's processed oils. Those will all cause acne. But I also know that when I am around just a couple of days before my cycle, I'll pop up with pimples. That's a hormonal imbalance. But during that time, I'm really careful to avoiding certain foods, right, that I know are going to be triggers, especially refined carbohydrates. Right? Okay. Are there supplements that can help? In my experience, making sure that your vitamin D is where it needs to be. Okay. Omega fish oil, extremely beneficial EPA for the skin barrier and that layer. Very, very helpful. Making sure you're eating enough sources of vitamin A. And in my food sources of vitamin A, and in my patients who have gut issues like inflammatory bowel disease or SIBO or hyperpermeability, um, what we'll call leaky gut, I always definitely put them through the 5R protocol, where of course we are removing the trigger foods, we are replacing with enzymes, we are rebuilding that lining of the mucosa with things like L-glutamine in high dose. I'll use N-acetylglucosamine. That also helps. I'll make sure they're getting enough zinc, zinc carnosine, that they're getting the right amounts of vitamin A and E and C, the antioxidants, to help support the skin lining. And of course, it's not on the list. Supplements are important. Right? We talked about vitamins. We talked about omega fish oil. We talked about glutamine. We talked about N-acetylglucosamine. But hey, let's not forget some other key things in addition to eating a healthy diet: hydration, 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 and use your sunscreen when you get out there. My name is Dr. Vivian Asamoah. I hope this was super helpful, guys. Please leave questions in the comment box. I'd be glad to answer all of them. There is definitely a gut-skin connection, so beware what you consume may reflect on your skin, right? And don't spend too much on expensive products. Start with healing the gut first by eating clean and super healthy. Hope you guys found this helpful. I found it extremely helpful. It's always a great refresher when you're looking at working with a patient on their gut issues and realizing that, wow, this could lead to other systemic issues: skin, joints, brain fog, a lot of other systemic issues. So very important place to start. Heal thy gut. Again, my name is Dr. Vivian Asamoah. I'm an integrative gastroenterologist in Houston, Texas. And stay on, subscribe to our channel, and you can continue watching our amazing videos very often with expert guests on anything related to natural gut relief. Have a wonderful day. Bye.